Turn my sound down. You see the computer from here. So we don't have.
Recording in progress.
It's true.
Good afternoon. Welcome to the Bloomington Rotary Club's weekly celebration of service. I'm Steve Wicks, and I'm honored to serve as your president this year. Please silence your electronic devices. On this day in history, February 24th, 1977, U.S. President Jimmy Carter announced that U.S. foreign aid would consider human rights. Changing our lineup, our order of events a little bit this morning, Lynn Schwartzberg will introduce our guests today.
Well, it's just noon, so I can't say good morning or good afternoon. So welcome. I have several guests to introduce today. When I read your name, if you will please stand so we can recognize you in attendance. We have a guest of Shelley Salih. We have Michelle Gilchrist from the Bloomington Hospital Foundation. We have two guests of our dear Ellen Stroman. We have Melissa Van Buskirk and we have Brianna Featherston. And Steve Engel has two guests. He has Brad Meyer, maybe? Hard to read this stuff. And Becky Wan. Please welcome them. Are there any guests online?
Lynn, we do not have any guests online.
Well, thank you, Joy. If you have any questions about our club or interest in Rotary, please speak with someone at your table.
Thank you, Lynn. Sarah Laughlin is going to deliver today's reflection, and since she'll be already up in front of the group, she'll provide us with an update of the district grant process.
Which will actually be kind of one and the same, God willing. Tyler's bringing up the PowerPoint. But I'll just get us started by saying that I think I've been involved with the district grant process since right after I joined the club. The first pictures I have are from 2012. And so that's 13 years of district grants. And what I wanted to talk about is, you know, our club vision says that this club will create significant positive impact in our community. So in 2012, I wrote the first grant that I'd written, and it was before the Rotary Toast. So we were always concerned about having, not so close. We were always concerned about having enough money to match. This was a $2,000 grant, $1,000 from us, $1,000 from the district to buy cheese for the Hoosier Hills Food Bank, something that was high protein and hard for them to get. In 2013, we replaced the sun screens, the sunshades at Mills Pool, and I don't have a picture of that. But in 2014, we supported the Education Matters project in the district the Democratic Republic of Congo. Many of you will remember we worked on that project for several years. We bought bookshelves. We put a fence around and some watering stuff around a garden they had. We actually wrote a book about the project and sold it to benefit them, produced it in French as well. In 2015, we supported RILA, the Rotary Youth Leadership Retreat, which is every fall. We were able to send twice as many students, and they had a reunion halfway around the year. In 2016, we rebuilt PALS, the fence around PALS. Some of you will remember we took down the fence, which was not an easy thing to do, because they had drainage problems in their outside exercise area for the horses. And then after the drainage was fixed, we rebuilt the fence. And you wouldn't believe how hard it is to make a fence post straight, you know, straight up and down and straight in a line. The next year, we funded the sunshade at Fairview Elementary School. And our volunteer role there was we helped the kids play during the dedication of the sunshade. We helped the kids play non-competitive games on the playground. Oops. Oh, did I do that? Oh, I'm back though. The following year, we painted the inside of Amethyst House. I think some of us, it was the very first time we'd ever painted a wall. It looked pretty good though by the end. Despite that, we didn't spill anything, even though some people tried to carry the rolling pan up to the top of the ladder. Not a good idea. The next year, we paid for and helped out at the dedication of Wonder Lab's Sprouts space for little kids, who, you know, a special place for the little toddlers and crawlers to be not overwhelmed by the bigger kids. The following year, this is the pandemic. You'll recognize Owen Johnson there with his mask on. Nevertheless, we packed Backpack Buddies books, bags full of books and other school kinds of learning things for kids who were stuck at home, literacy backpacks. The following year, still a little bit pandemic-y, as I remember, we sponsored we helped out at the Lotus Blossoms Bazaar, which is a 2-day event. The first day, I think, is 3rd grade kids, 4th grade kids from every school come for a day of international, you know, world music. And the next day it's open to the kids and the community. So the kids and their parents. We helped out for that and had so much fun. The following year, we did a farm to school program. MCCSC takes every 3rd grader to a farm to see things growing. This is a 3rd grade group at Sobra Mesa Farm. And our job was to help the teachers keep them under control while they were there. The following year, we did we helped out the Lake Monroe Water Fund. We did some beach trash pickup. We hosted their Lake Monroe Day events at the farmers market and at the Upland afterwards. And last year, of course, you remember My Sister's Closet. We built probably the world's most incredible bike rack. It's not up yet because they're moving, as you know, and they didn't want to put it up and then have to move it, take it down and move it. So it'll be up, it's stored safely, and we look forward to dedication number 2 when the move is over. But here you see Bill Brown and Caleb Poor using their artistic skills to help out. And this year we supported Meals on Wheels. We bought 3 of these refrigerators that you see on the left. They can be all refrigerator, or they can be all freezer, or they can be half and half, which dramatically expanded their ability to have fresh food for their groceries to go program. And we also bought 500 of these bags. It's a little bit, I realize my photographs may be a little over cropped. But the bags are branded Meals on Wheels and Rotary. And we delivered those we rode along with their daily delivery, Meals on Wheels delivery, and delivered them to 118 households in Bloomington over a week. And probably the significant positive impact, long-term impact of this project is that we've adopted Meals on Wheels now as an ongoing club project. So we'll get to help do pack more groceries to go. And a couple of our members have signed up to volunteer. So sometimes that happens. So what's next? That's really, yeah, we've been busy, haven't we? As a club, I'm so proud of this club. So you can probably tell from the pictures that in addition to the significant positive impact, is it fun? Yes, it is quite fun. So what's up next is up to you. So how many of you work for a nonprofit? Raise your hand if you work for a nonprofit and keep your hand up. How many of you are on the board of a nonprofit? More hands go up. How many of you are a passionate supporter of at least one nonprofit? Keep your hands up all, because what we see is everyone in the room, right, is involved in this town, one of this town's 700 plus nonprofits. So would that organization that you're thinking about, that you're involved with, would they be excited about $6,000? The ones that I know, that's a big amount of money. We work hard to raise money, and that would be a significant gift. And what about a day of Rotarians volunteering to do something that you have had a hard time getting around to doing? So that's our next, we just sent in our 2025 report, and now we're ready to start working on the 26-27 project. So on your table, and it'll also be in the roundabout, a link to the proposal form. What you have to do to be chosen as a project for the Bloomington Rotary Club is you have to be sponsored by one of our members, and you have to submit this proposal. And we ask that it be 2 pages. So it's not a killer proposal. No audit required, no 990 to send in, no board signatures, just a simple proposal. And so what we count on you to do is to distribute this proposal opportunity to those nonprofits that you're involved with. Give them a call, say we have this opportunity at the Rotary Club. Here's the proposal. I'd be happy to sign up as the person sponsoring you, and send them to me if they need any help in writing the proposal. The deadline for receiving the proposals is, it says on the slide, March 28th, but I think it's actually March 27th. It's Friday, March 27th, I'm pretty sure. And then the Community Service Committee reviews all the proposals. We have a rubric that we use, and you can see it along in the proposal, because we want the proposers to know what they're going to be judged against when it comes back to us. And we'll let them know by April the 10th. And then the next step is we have to send it on to the district. So I'll be working on the application with the successful proposer between April 10th and May 1st. We have to submit it to the district by May 1st. Then we have a bit of a wait, because not only does the district approve it, but it has to go all the way to RI for approval there. And so usually it's about the 1st of August when we get the approval back, and we have to be finished by the end of March. So it's the project timeline is August to March. Doesn't include the summer, notably. So trail repair projects are a little problematic. August to March. All right, that's it. I hope you realize that we have an opportunity to make a significant positive impact and have some fun. Thanks.
Thank you, Sarah. Your fingerprints are all over all the successful projects this club has done in the last 12 or 13 years. Birthdays, we have one birthday to observe, Eric Coyne on the 1st, and then Rotary anniversaries on the 28th, Amy Garst and Carlos Laverty, both 3 years. On the 1st, Chaz Mottinger, 3 years. Club treasurer John Zodi, 5 years in this stint, 8 years with the club total. And also on the 1st, John Hobson, who is here somewhere, 41 years with Rotary. Only a few announcements today. Rotary District Conference registration is open, scheduled for May 8th and 9th at the Galt House in Louisville. I think there's going to be a lot of fun scheduled Friday night. Saturday will be filled with productive programming. You can learn more and register at rotaryallstars.com. Those of you who have any connections with Bedford, their Rotary Toast will be held this Friday evening, February 27th. If you have any interest in attending, please see me for the details. Next Rotary Club book meeting, save the date, April 15th. And regular scheduled meeting on the 17th will be our club assembly and annual meeting. And then finally, Sarah made mention to this. We have a mini project scheduled now for March 4th, 10 to noon with Meals on Wheels. Be packing groceries to go. We need up to 4 people. If you're interested or you want to learn more, see Diana Hoffman in the back there, or Mandy or me for more details. And now we have some membership time. Celebration of Service. This was not a Rotary project, but the Hoosier Hills Food Bank had their annual soup fundraiser this weekend, and lots of Rotarians in attendance. And Alan Barker was called out by name for his contributions. And also Charlotte Zitlow was mentioned for everything that she had done for that event. So I was proud to see so many Rotarians in the audience helping Hoosier Hills Food Bank. And we're going to do the Mystery Rotarian today. It's been a few weeks since we've done this. Once again, I will provide a clue. If you know the answer, put up your hand. Don't shout it out. Those of you online, if you know the answer, put up your hand electronically. And here's the first clue. Born and raised in Woodstock, New York, this Rotarian was exposed to peace, love, and music at an early age. This individual began playing the piano at age 8, learned transcendental meditation at age 14, and spent a summer at the Tanglewood Music Institute at age 17. Okay, I see a few hands up in the room. Okay. Second clue. This Rotarian previously worked as Director of Social Services at Meadowood and Executive Director for Bell Trace. For the past 5 years, this Rotarian has owned and operated Anchored Passages, providing competent and compassionate non-medical guidance and support to individuals and their families during the difficult passages of life. Yeah, we have quite a few here. Yeah, okay. Final clue. In the local community, this Rotarian has served as the Area 10 Agency on Aging Board President, currently serves as Board President for Limestone Post. Club member for just under 20 years, this Rotarian has served in multiple roles, including Club President, Chair of the Youth Services Committee, Assistant Governor, and frequent Zoom host, including today, Joy Harder. Rex, I think you were the first one to put up your hand. Did you have it right? Good job, Rex Hillary. And Joy, besides you, did anyone online have it right?
I'm pretty sure Raj had his hand up, and I think Sandy Keller was hip to the program, and Marcy was, so yeah.
All right, excellent. Joy obtained her bachelor's degree in psychology from Kenyon College, her master's degree in counseling from IU. She is a certified death doula and conscious dying coach, or end-of-life specialist. She has completed her Reiki 3 master practitioner training, and Joy recently began offering community sound baths. And here's a picture of a sound bath. I've been to one of them. It was really cool. Very restful, very relaxing. Joy does a great job. If you have an interest, contact her. And then here's a picture of Joy doing one of her Rotary voluntary activities. This is from Ryla this past fall. She spent an entire afternoon there registering students so they came in the door. Joy is kind of interesting in the sense, as club president, she was the one who introduced the 5th part of the Rotary 4-way test. Is it fun? But I'll also say in her professional role, with her personality for a family dealing with the death of a loved one, I can only just be sure that she would be really great in that role. So it's wonderful having Joy as a member of our club.
Thank you, Steve. Thank you, everyone.
Rotary International 7 areas of focus. This is the last week for Peace Building and Conflict Prevention Month. And then we're just going to spend, well, just a reminder, we're not doing Happy Dollars today, but the proceeds in Jan and Feb will be given to Teachers Warehouse. Club members were especially generous last week. And now, Tyler, if you want to pull up, we're going to just spend a minute or two going through my Rotary website. So for those of you, myrotary.org is the Rotary International website. And if there's up there, I can't see it from this angle, but if you wanted to register for Rotary, it's really easy to do. You put in the email, the same email that you used when you became a club member, and then they'll help you create a password. But what we're going to do today, Tyler, if you'll work your way down the page, is just look. You've gone, I'll keep going. Right, I've missed it. Get involved. Sorry about that. Go ahead and if you'd click on that. So this is something you can do without logging in. You can see different ways to get involved. And one of the ways that we're going to focus on today is a Rotary Action Group. You go ahead and click on that, Tyler. And here is a very short video. And the sound may be off.
Rotary Action Groups are a great resource because they have the expertise in their various subject matters to support clubs and districts with project implementation and execution.
Across the world, there's so many different action groups. There's one for environmental sustainability. We've got disaster response. We have water and sanitation.
If somebody wants to know how to build a toilet, drill a borehole, implement rainwater harvesting, for example, action groups have the expertise to enable the club to achieve its humanitarian goals.
They are not just Rotarians or Rotaractors. It could be, partners. It could be alumni.
A Rotarian doesn't have to be an expert because they're all at hand.
And when a club wants help, we link them with sources of funding, usually another club, but also to private donors and other foundations.
When you've got this group that has members from around the world in one particular focus, you can have an impact that is huge.
You could close that out, Tyler. We're just going to look at one group very quickly. So here's just a list. You can see a list of different ones. Let's go to Peace. It's the top one because this is Peace Building Month. And you can see here's a site if you're interested and you can learn more. So anyway, this is Rotary for us locally, but Rotary is international as well. If you have a particular interest, you can go on this. Like I said, it's real easy to get to and you can find it. So just keep it in mind, log on to myrotary.org and just explore. Okay, Shelley Salee will introduce our speaker.
Good afternoon, everyone. Today, I am delighted to introduce your fellow Rotarian, Cindy Brumbarger. Cindy has been a part of HealthNet for nearly 17 years, was named Chief Branding and Engagement Officer in December of 2025, after serving as Chief External Affairs Officer. She's had some mighty good titles. She leads brand identity, outreach, marketing, patient experience initiatives, outreach enrollment, and acts as board liaison. Cindy also serves as the executive director of HealthNet Foundation. She does quite a bit. Cindy brings more than 15 years of nonprofit leadership experience as well as a clinical background, having worked as a critical care nurse with a focus on bone marrow transplant at IU Health early in her career. Cindy earned a BS in nursing from Indiana University, Master of Education from Western Governors University, and completed UCLA Anderson's Healthcare Executive Program. She currently serves on the boards of Heart and Soul Free Clinic, Southeast Community Services, and Edna Martin Christian Center. She is a passionate advocate for sound health policy and ensuring that access to care is addressed on a daily basis. Today, she will share more about the role of community health centers nationwide and the warning signs that we all need to be paying attention to today. Thank you, Cindy.
Well, good afternoon, everybody. Thrilled to be here. Thank you for that, Shelley. I appreciate it. Some of you are aware of HealthNet. Hold on just a minute. I'm trying to get my notes to work here. There we go. How many of you are familiar with HealthNet here in Bloomington? Awesome. That's exactly what I want to see. I'm going to speak a little bit to the nature of HealthNet, but I really want to expand our conversation to talk about community health centers in general. Community health centers are both a lifeline for the patients and the communities that they serve, but they also serve as the proverbial canary. They are that early warning system as to what's going on in the healthcare landscape. As community health centers, we are the first to see trends, often trends that are concerning. That includes access to healthcare, the expense of healthcare, and the efficacy of the healthcare that we're providing. So let me start by talking about what a community health center is. A community health center is a federally qualified health center. What that means is that we as a health center meet distinct criteria as it relates to the federal definition. That's very specific to how we provide care. It's very specific to the removal of barriers to access that care and making certain that healthcare is always accessible. When I speak to those barriers, I'm talking about those non-traditional barriers that some providers of healthcare don't always consider. We are community-based, which means that within a community, we're engaged in that community. HealthNet is here in Bloomington. We also have 8 locations in Indianapolis. And one of the things I adore about the community nature of our particular health system is that each community health center has its own personality, its own flavor. It looks like the neighborhood and the zip code where it lives. It's one of the things that makes community health centers so incredibly special. The other element that I truly appreciate about not only HealthNet, but every community health center in the nation is that they are required to have a board composition that is majority patient. I want you to think about that for just a moment. That governing authority must be made up of individuals who are seeking care, the majority of such. So that's a really unique element when it comes to board governance in a nonprofit space. We provide care in underserved communities. Those are the communities where a lot of individuals don't want to plant their flag and provide care, Community health centers, we're kind of the antithesis of that. We're like, let's do it. That's where we want to be. When we look at establishing a health center, we look at the data, we look at the access. We want to make certain that if we're going to be present in a location, that there's the potential for impact there. Generally, those trends, when we look at a location for a health center, tend to see a community that's disproportionately struggling with things like poverty and access. They've just been a population that may have been overlooked for time. We're happy to be part of their community and look to change things for their betterment. We do see everyone regardless of their ability to pay. Often when I make that statement, people just assume that means anybody who doesn't have access. I like to really expand that idea of regardless of ability to pay. If you are commercially insured, if you are on the marketplace, if you have Medicaid, if you have Medicare, emergency Medicaid, no money to pay at all, we will see you. Your healthcare coverage status does not matter to us. We not only want to see you, but we have a federal obligation and are required by law to see you. Walk into another primary care practice and tell me that that's consistent. You won't find that, but that is the heart and soul of community health centers. So what is a community health center not? So we're not a free clinic. I always like to make that distinction. Obviously, if an individual walks in, we are going to see them regardless of their ability to pay. But the care isn't free. We will navigate that with that individual to put them on a sliding fee discount program. That's also a federal requirement for all community health centers. We are not reimbursed when we provide care to somebody who doesn't have insurance, right? So there's a myth out there that community health centers get all kinds of money if they see patients who aren't insured. Not true. Most of the time, if we see someone who is not insured, we work to put them into a healthcare coverage program that fits them. If it doesn't fit them, we put them on a sliding fee discount program scale and hope for the best. The nuance there is we're not reimbursed, but we still see them anyway. And we're going to talk about that here in just a moment. And then finally, we are not a temporary safety net. We are an essential part of communities across the country. HealthNet, for example, has been around for 58 years. Community health centers take their roots all the way back to the Johnson administration and his war on poverty. We are not just a stopgap, we are the bridge for communities that are in need of healthcare. The other thing that I really like to highlight is the comprehensiveness of our care. So not only do we provide primary care, but we also provide access to behavioral health services, dental services in many of the locations. Some community health centers are now opening up pharmacy access because we know that there are food deserts, there are healthcare deserts, and there are pharmacy deserts. So that is one of the things we see growing in that community health space. And then in some instances, community health centers are in a position to offer additional services. For HealthNet, that includes an eye care center, podiatry, chiropractic care. We have nutritionists on staff. We've also opened up in the past year access to rheumatology and dermatology. It's hard enough for you and I to get a dermatology appointment. Imagine being a patient at a community health center and trying to get access to a dermatologist. Good luck with that. We're trying to change that. I guess the bottom line is this, that we are a permanent and critical part of the health system in both urban and rural America. And when I say we, I am truly speaking to community health centers, not just HealthNet. So let's take a look at that national impact. I'm a data geek. I love the numbers. I think the numbers come together to tell the story, and then you use that passion to weave those numbers together into something really meaningful. So if you look at the 2024 data, this was just released in early January. Community health centers served 52 million unique patients nationwide. Those are unique patients, not collective appointments. That's 1 in 7 Americans have received care at a community health center. All in total, 145 million visits. So when we think about the impact of community health centers, this isn't just a one-off and they're not just here or there. We're talking about being an anchor thread in the tapestry of our healthcare system in this country. CHCs deliver high-quality primary care at a lower cost. This piece always fascinates me, especially when you get into the politics of the Reds position and the Blues position. At the end of the day, whether it's access or fiscal responsibility, when you look at the outcomes with CHCs, we perform better. I'll give you one statistic to kind of frame that and put that in context. If you look at a Medicaid patient in the state of Indiana receiving care in a community health center, the cost to the state is 24% less than a patient who doesn't receive access or care at a community health center, and moreover, the outcomes beat the industry average. I think that's pretty impressive. CHCs offer those comprehensive care pieces like I talked about. We operate under a patient-centered medical home. Again, this isn't just HealthNet, this is CHCs across the entire country. We know that if you have one home for your care, not just your primary care physician, or not just a behavioral health therapist over here, or maybe care for your dental in the other zip code, when you bring that together collectively, you get such cohesive care. And that's what a patient-centered home is all about. We are the go-to player in community health. If you look at the impact that CHCs had during COVID, we were on the ground making certain that vaccines were delivered to those zip codes that may have not had access. We were the experts in making certain that care was delivered when there were barrier after barrier after barrier that needed to be overcome. Here's the truth. It's what we do. It's why CHCs are so incredible and so important. And there's a couple of them, as I mentioned. There's quite a few of them here. That's just kind of a distribution map here in the country. I think what's really interesting, and I didn't bring this for the presentation, but I will tell you, if you took an overlay of this map and you looked at income, what you would find is the distribution of community health centers kind of mirrors those areas that have higher poverty level rates. It's really, really interesting to look at. So let's talk about that Hoosier impact. We are here for thousands of Hoosiers. That's the distribution here in Indiana. There are 41 FQHCs in the state with more than 400 delivery sites, 436 to be specific. 29% of FQHCs here in Indiana are in rural settings. They are the lifeblood and they are essential to those areas that we are now watching lose access to care. It seems like every time I open up my feed, I see another headline about services being cut in a rural community. I know we just saw that big announcement with Johnson County. They're closing down their maternal provisions in the hospital. Those things are heartbreaking and heart-wrenching to me. CHCs are ready to stand in the gap whenever we can. As for patients, 820,000 Hoosiers received care, with 273 of those patients being children. I think it's a really impressive number. Here's where we're different though. If you look at community health center care in Indiana, you will note that 39% of our patients sit at or below the poverty level. If you extract that to the entire population, that's only about 12% of the population of Indiana. So 39% of our patients fit a demographic that really only compromises 12% of the general population. When we look at Medicaid patients, the same holds true. 41% of our patients are Medicaid patients. General population is about 17% across the state. Now, I will tell you that while that data may raise some eyebrows, it's old. What we are seeing, and I'm going to speak to this in just a moment, this is that canary. Its feathers are pretty ruffled and it's struggling right now. The reality of it is that Medicaid number is dropping, it's plummeting, and our uninsured is skyrocketing. And that's really, really concerning for us. We are an essential support to making certain that healthcare is accessible. 14% of patients seen by CHCs in Indiana have been uninsured. That is old data. That number is approaching 20%. And some of our industry experts believe that we'll hit 25% in early 2027. It's not a great picture there. As for my friends in Southern Indiana, here's just a couple little nuggets for you. I just pulled the data specific to the 2nd District. Here in Southern Indiana, 6 FQHCs, including HealthNet, 27 service sites, serving 220,000 patients in 2024. In an age where we continue to hear about the loss of services, as I alluded to, especially in rural locations, you can see why it's so important that we have CHCs available in the state. Moreover, what we know is that by using community health centers, we're able to help patients avoid things like going to the ED for their care. That's so much more cost effective. The outcomes are better. But as we begin to see stresses on the CHC system, that becomes a rising concern. So let's talk about what happens when CHCs fall out of the picture. Here's the thing. The care and the need for care doesn't go away. That never changes. No matter what is happening in the healthcare landscape, the care is needed. And we start to see that care divert just a little bit. We do see preventative care decline. So we are in the business, or we would like to stay in the business of healthcare. As we see access erode, now we have sick care. The health outcomes when you focus on sick care are not great. We really want to be in the business of healthcare. Preventative care begins to decline, and we all know that with the decline in preventative care, the outcomes begin to look less rosy. We certainly see those poor outcomes already in some of the underserved communities where community health centers are. We don't need to make that more complicated. And then finally, we have this rise in cost. The rise in cost hits our state budget. It hits our insurance premiums because that cost has to be collected elsewhere. The healthcare ecosystem begins to get stressed and phrased, and then suddenly the community is dealing with a healthcare concern. So let's talk about our canary. When CHCs see a problem, the community is already at risk. So I want to go back to some of those principles that make CHCs really unique. Remember, we are the first line of defense for a lot of people. We see everyone regardless of their ability to pay. If they walk in the door, we see them. So we often see those warning signs a little bit earlier. Our comprehensive approach has merit. It works. But when you don't walk through that door, we're not able to provide that. For us right now, the things that are bringing us pain include the rising uninsured. You've no doubt seen some of those headlines about the number of people who are no longer on Medicaid. I think the one number that was really championed by some in Indianapolis was 300,000 people have been removed from Medicaid. You can champion fiscal responsibility, but there has to be a conversation about the consequence of people losing their health care coverage, and that is very, very real. When the demands exceed capacity, things begin to really fall apart. So the crisis that community health centers are seeing today, not just in the state of Indiana, but nationwide, are multifold. We are watching the uninsured climb. We are watching patient visits drop. Is there a relationship? Probably. Good chance that there is. And other sources of funding are now coming under incredible scrutiny, and some of them even being removed. As the demand for care coverage climbs, the people visits stop, and we start to see sickness increase. At some point, people who are sick, who don't have care coverage, are going to have to see someone. And where are they going to go? They're going to the emergency room. They're going to the ED. Number one, that's incredibly expensive. Number two, by the time you get there, your care is so complex when you could have been able to see a primary care provider on a routine basis at a much more cost-effective position and control your disease early on. I'm going to get really down to the basics here. How many of you own a car, have driven a car, have had a car? Not hard, not hard. Many years ago, I had a sweet young cousin whom we gifted a car. It was a beater car. Don't get too impressed. I wasn't that wealthy, still am not. But he was in college and he needed some wheels. And so we gave him a car. He never got the oil changed. Didn't get those tires rotating balanced. Didn't think about, coolant flush, taking it in for that preventative maintenance. Anybody see where this is going? And to nobody's shock, the car just didn't quite make it, not for long. We're the same way. You can replace the entire engine block at incredible cost, or you can change the oil on a routine basis. You can go see your primary care provider. You can have educated decisions. You can discuss whether immunization and vaccination is right for you. Run the screenings, catch things early. Get this. Did you know that stage 1 breast cancer, if you are diagnosed with that today, 99% survivability. 99% survivability. That's stage 1. If you don't have health care and you're not going in for your preventative screenings, are you going to catch that at stage 1? Think about that. I saw a fascinating statistic that said if Americans had their well visits annually, we could be saving at least 100,000 lives a year. That's just by going to the doctor on a routine basis. And if it's every 18 months, I'm still happy as a clam. I don't care if it's every 12 or 18. Go regularly. Needless to say, when people aren't going in for their primary care visits and they're getting sick and they're going to the ED, it becomes very expensive. Here's the thing that maybe we don't talk about enough. I want you to think a little bit about what happens to our economy and what happens to our state a couple years out. Forecast this. Now we have individuals who aren't seeking care. We're now seeing poorer health outcomes. Our maternal fetal health statistics, they're not attractive. We're watching chronic disease climb. We're watching cost of managing chronic disease climb because it's out of control. I'm an employer looking to relocate my headquarters to the state of Indiana. I'm bringing a lot of jobs, high-tech jobs, people with professional smarts into the state, and I'm going to flood it with dollars. But when I see the health outcomes in your state, do I have pause? And do I get concerned when I see a state that has some of the most expensive healthcare in the nation with some of the most horrible health outcomes and a crazy uninsured population? Why would I relocate to Indiana? If health policy doesn't get your attention, I would think that the fiscal picture would. And that matters to every single one of us because we're not only taxpayers, but we're residents of communities that are being impacted. When systems are undermined, these are some of the outcomes that we're concerned with. As CHCs look to continue to fulfill their mission and live out healthcare policy, the deck is beginning to seem stacked against us. Policy is driving an absolutely unsustainable model for community health centers. Remember, we're required by law to see everyone regardless of ability to pay. That includes the uninsured. When 1 in 5, quickly approaching 1 in 4 patients is uninsured, that business math doesn't work. The rate of uninsured is probably one of our most concerning elements, not only because of the health outcomes, but because of our ability to stay open and do business. And then finally, the biggest concern we have in the state of Indiana currently is regarding something called 340B. I'm not going to get into it. It's messy, it's complicated, it's difficult at best, but let me give you the Cliff Notes version. In 1992, Congress wisely recognized the need to provide financial support for essential services like community health centers. In the Veterans Health Care Act, they instituted the 340B program. This is a congressionally approved program whose purpose is, and I quote, to enable essential entities like community health centers to stretch federal resources so that eligible patients can be provided with more comprehensive care. We continue to see growing restrictions on this particular program, mostly because of the heavy lobbying from pharmaceutical manufacturers. And this includes increasing administrative burden for us to access the same funds. This year, the state of Indiana has filed a state plan amendment with the Office of CMS that would allow the state of Indiana to take those funds, and instead of those funds going directly to community health centers across the state, they would go directly to the state of Indiana. We are talking millions and millions of dollars that community health centers will no longer have access to. The consequences are dire. We have a loss of insurance, we have an escalating uninsured rate, and now the state of Indiana is looking to carve out critical dollars that will allow us to continue to provide care. You can connect the dots. You're smart people, I have no doubt. But I think it's important that you know what's going on here in the United States, what's going on in Indiana, and what's going on in Bloomington. So how can you help? Be educated. Understand the role of community health centers in your community. If you have questions, I know a girl who would love to talk to you. There are some great resources I can make available to you. Happy to see you afterwards, get your info, and get you connected. Sign up for the HealthNet advocacy alerts. That way you know what's going on any given day. But more importantly, advocate. Support the policies that strengthen, not weaken, primary care, including funding for community health centers. Be a voice for health access and stability, and raise awareness about your concerns regarding 340B. I want to thank you for your time. You've been delightful. You've let me be a little bit passionate and ramble on about this topic. I am happy to take any and every question you want to toss at me.
Thanks for the presentation, Cindy. Can you talk to us about veteran care? So looking at the map. Just curious how VA centers, you're trying to get a VA clinic in your city. If you see a veteran who needs care, do you treat them or do you coordinate with the VA? How do veterans interact with community health centers?
We do treat them. I don't have the data at my fingertips, but it's a significant number of veterans that we treat. Usually when that happens is because there's not a veteran access point readily available. What we will do is treat them, take care of their issue, and then if there's a referral that needs to happen, work with them. One of the things I think is great about community health centers as it relates to referrals is that we have things like social workers and resources to connect people to that type of care, a better fit for their care. And so that's different than what you see in most primary care practices, but that's certainly what happens. Yes. Oh, sorry.
I'm a retired ER physician.
God bless you.
And worked everywhere from Richmond to Loadsport to Evansville. And I guarantee you at least 50 to 60% of all the patients I saw were underinsured or Medicaid eligible, whatever. When one has an emergency, what they could perceive as an emergency, they run to the ER. They don't run to the community health centers or any of that. Just because of we have to see everybody that comes.
Yeah.
It continues to be an issue. It's been that way for 50 years. It's never changed, not in Indiana.
Yeah, and I think you bring up a great point. It's really one of the reasons that currently HealthNet is looking to open a HealthNet Now opportunity. So we're trying to really promote same-day care and even have walk-in hours for individuals to come in that same day for those visits that aren't ED appropriate. If you're feeling sick, we definitely want to take care of you. Maybe going to the ED for an earache isn't the best fit, but coming to see primary care and being able to walk in and get that care is something that we can encourage among our patients. It's a patient education issue, and as you well know, it is ongoing and may never be completely satisfied. Thank you again for your time in the ED. That's a valiant, heroic position to take on.
Cindy, we had a question online from Sandy Keller. Andy?
If she's not, oh, there
Sorry.
she is.
I didn't know my audio wasn't on. Is there dental care available, and to what extent is that available for low-income residents?
Yes, so dental is a requirement. It's a required service for CHCs. If dental is not available at a particular location, then that community health center is required to have a referral agreement with a partner in that community to pass on things like that sliding fee discount fee. That's requirement by federal law. So for HealthNet, we are lucky enough to have dental available in Indianapolis. We would love to find a dentist and reopen it here in Bloomington. There's a national dental shortage that we're just huge fans of. So whenever we're not able to provide a service, then we find a partner who is willing to provide those discounts as we are at the health center. Great question.
Not to put you on the spot on this question, if you want to get back to me later, I know you've got your folks know how to do it, but what can community leaders give you that we're not currently giving you to support your mission?
Yeah, that's a fabulous question. At a really high level, I think the biggest concern that we have is the advocacy piece. So much of what we're seeing in the drop in insured, the jump in uninsured is related to a couple things. And some of those things are outside of our control. Some of those things can be modified with legislation. So that advocacy piece comes into play. The biggest hurdle we have for 340B, quite candidly, is that we aren't able to make any kind of movement at the state. We have plenty of people who are trying to advocate for that. We actually just had an amendment that was put into some legislation that was going to be our out to save and pull back our 340B dollars. And unfortunately, the state intervened and extracted that, and it was never even heard. We lost that opportunity. So for that particular issue, and we can talk about other things later, for 340B, it's federal. Our last stopgap effort here is going to convince our federal representatives, both the House and the Senate, to go to the Office of CMS on our behalf and say, look, the state is asking to pull these funds back to the state, but the intent of the legislative language that was approved by Congress is X. It's to really support what we're doing. I might add, because it's a state plan budget amendment that goes to CMS, there's no opportunity for public input. It's an administrative maneuver. So as taxpayers, you have not had an opportunity to comment on that particular administrative maneuver. So really, if anything, maybe it's just reaching out to your federal representation and say, hey, I learned about this, email me, I'll give you some resources. I'm worried about what this is going to do to 820,000 Hoosiers, because it really could have impact.
I'm interested in what the CHC interaction is, or there's a plan for universal nonprofit healthcare that goes up before Congress, and hopefully we'll get it voted through. But is CHC's part of that plan, and how would that plug and play?
I know the CHCs have been mentioned multiple times in some different agendas related to making America healthy again. To that specific one, I'm not sure. What I will tell you is that the history and the model of the CHCs has produced the data that shows that it works, and they have been referenced many times when we're thinking about a more universal model. So we'll kind of wait and see what that looks like.
We got one more question online.
Yes, thank you, Cindy, for visiting with us. I appreciate your presentation. We need more of you than fewer. The program you present to us, it seemed to me a beautiful map for the country to follow and move forward with it. To be more specific, in our community of Bloomington, I would like to see your thought or your information about a pregnant woman who is uninsured and walk into the clinic. How do you manage that particular one? Another issue is uninsured individual who come to the clinic and they have high blood pressure or diabetes, etc., and you send them out where he or she receives the medication to help him be after the visit you provide.
Okay, two great questions, Raj. I'm so glad to hear your voice. You're on the screen behind me here. I'll speak to the prenatal first when it comes to fetal maternal health. If they walk into the health center, obviously we will see them. We do not have an OB on staff in Bloomington, so they're going to be referred out depending on where they are in their pregnancy and get connected with the correct resources so we can follow up with that prenatal care. I think Bloomington's really unique. I will make this plug really quickly, in that we have a lot of individuals who are showing up at the health center who have maybe emergency Medicaid or they don't have any coverage at all. If that's the case, their care is not covered by insurance, their prenatal care. Emergency Medicaid is pretty much delivery only in really simple terms. You have a very generous community here, an incredibly generous community. That goes all the way back to the volunteers in medicine days. And so we do have a small patient assistance fund where we try to make certain that prenatal care is covered for those women so they don't stop pursuing that prenatal care. This is where partnership comes into play. It's important that we have relationships with larger hospital systems and other community entities if there's a service that needs to be provided. Prenatal care is a required service for all community health centers. If we can't provide it at that point in time, we have to have a partner that we refer patients out to. To your other point, Raj, when it comes to education, that is one of the things that we try to follow up on. Obviously, if they have to be referred out, we may lose that patient. We would rather bring them back in and have them become a patient under our primary care umbrella where we can do that patient education. That is something that for the community, that's one of the things that I get to champion is community education through community outreach. But we do have the opportunity to possibly lose them if they leave our community health center. So we try to keep them close at hand so we can make sure they have the resources they need.
And our last question from Market.
Thank you so much for this information. I'm curious to learn a little bit more about the landscape of CHCs in public education across the country as well as in the state of Indiana. What's currently happening and what is the potential likelihood of something like that being expanded into public schools?
So great point. A lot of CHCs have presence in schools. They provide the health care. When we talk about all those delivery sites, they are often in schools providing that care. There's usually a nurse practitioner who's there. They can not only provide the care that you think of the typical school nurse. My mother was a typical school nurse, so I'm using those quotes really, really carefully. They do great work, but because they are nurse practitioners, they can go a little bit further in their care. In Indianapolis, we have a presence in 2 large high schools that have multiple team members that are on site in the high school where they can provide care. Indianapolis specifically, Raphael, Shalom, there are a number of FQHCs that's kind of their bread and butter. They do it really, really well. It's a micro community health center within the school to take care of those students and the staff. And families too. Yep. Thank you.
You're a credit to our club. In honor of your talk, a donation we made this quarter to Amethyst House. We're running short on time, so I'm not going to mention today's volunteers by name, but thank you. Our next regular meeting will be on March 3rd. We'll be downstairs in the Frangipani room. IU Student Foundation Race Director Peter Schultz will speak to us about the life of the Little 500. Tyler, if you would please share the graphic for the 4-way test. Please stand if you are able and join me. Of the things we think, say, or do, first, is it the truth? Second, is it fair to all concerned? Third, will it build goodwill and better friendships? Fourth, will it be beneficial to all concerned? And fifth, is it fun?